Hi, I'm Virginia from the Patient Information Forum, also known as PIF, and I'm here with Dr. Sophie, who is a health information content creator. Today, we're going to ask them how they create trusted evidence-based health information, and you'll also learn about what they do, why they do it, and maybe you can do it too. So let's get started. Thank you, Dr. Sophie, for being here today.
It's so nice to be here. Thank you for inviting me.
Thank you again for your time. I know you're quite busy. So let's get started. What kind of health information do you create?
So I have a YouTube channel, which is called Dr. Sophie GP, and it is patient information videos. Some short ones, less than a minute, but most of them are kind of long form, around about 10 minutes of kind of common conditions I see every day as a GP, things you see in primary care.
Amazing. And so why do you create health information?
Well, I started off at my channel as actually because I did a diploma in lifestyle medicine. And I was fascinated by everything I was learning. And I think talking to my husband nonstop about lifestyle medicine, and he said, "Why don't you make a YouTube channel?" He works in TV, so it was quite helpful. He was quite keen to be on board to kind of film it for me. And then I started realizing that some of these were useful to share with my own patients. For example, one's about sleep problems. And so then I thought, gosh, this is actually really useful to have something that I can text a link to patients to give them much more information than I have got in 10 minutes. So I just started to do a few more, and I thought, oh gosh, these are really helpful. I did one on menopause and HRT because that's a really complicated issue to manage in 10 minutes. And often you will have to give lots of information in the first appointment and then say, well, go away and have a think about that and make another appointment. And if you want to go ahead and we can get started. Whereas now that I made this video, the patients can watch it in advance, make an appointment if they're happy and want to go ahead with HRT, and it means we only have one appointment. So in terms of patients, they've got all the right information they need, got time to think about it, even watch it twice if they're not sure. And in terms of the clinician, it's massive efficiencies and means you're not repeating yourself 100 times a day. And you know that the patient's got the right information to go forward and make good shared decision making. So I just started doing more and more and got really excited about it when I realized how helpful they were being for me and my practice. And then other GPs started using them. Even GPs around the world started using them. So I then kind of focused it more on just being helpful for primary care.
Amazing. So you mentioned there that it helps you become more efficient during your appointments. Do you want to kind of give us more detail on that? So what do you now do with that extra time with the patient if you are spending less time explaining information because you can give them a video pre-appointment or post-appointment? How are appointments running differently now?
Well, so we rely heavily now on e-consults. So if a patient is able to, we ask them to send their request via an e-consult rather than ring, and to give all the information, and to send a photo if relevant. For example, it may be that someone has eczema. And so therefore, instead of having a face-to-face 10-minute appointment, which we would have done a few years ago, I can just have a look at photos. It looks like fairly simple eczema. I've got a video on eczema. So I text back, here's a link to my video on eczema. I've sent across some emollient and steroid cream. It explained how to use it in the video. Have a watch, and then I can click a reply button. Reply if you still want to speak to a clinician after this. And nine times out of 10, they don't. So it means that we've saved an appointment. And when for example, when I'm duty doctor, it means instead of, because the BMA recommends that each GP has 25 patient contacts a day, which would be lovely, but it's realistic to the demands that we have now. So, for example, on I think the 3rd of January, we had 500 patient contacts during the day, and I was duty doctor all day. So obviously, I can't give everybody a 10-minute face-to-face appointment, but the point is not everybody needs it. So by doing this, I'm very efficient and I can manage people appropriately. And it means that I have got appointments available for the people who do need that consultation and do need to come down and be seen. So we now monitor our own practice, and the amount of patients who are dealt with within 2 days is hugely high because we've got space for appointments, or they've been dealt with via a quick phone call or even a text. And the videos are what really helps make that difference.
That's really amazing. It's really one of the amazing things from that story is that one of the criteria in the PIF tick is to measure the impact. And that is such an amazing way to measure the impact of your content creation, because it's not just making you more available to your patients and giving your time more efficiently to them. It means that you can see more people and you can cut the need for appointments where they're not needed. And that also puts less pressure on your team as well, and all of the staff that help you to actually run those appointments and give access to those appointments.
Absolutely. So I make the videos with the idea, well, kind of that patients may come at them from twofold: either text from their own doctor or healthcare clinician, or they may find it themselves on YouTube, either because they know about me now. So, for example, perhaps their GP sent them a HRT video. Maybe next time they'll think, oh, I think she had one about PCOS, and then look at me that way. So the idea is that, yes, so it's twofold, but I think mostly it's coming from GPs at the moment. But so absolutely, I want the patients to be empowered to have better engagement, but also it is absolutely about the well-being of staff, because as a frontline GP myself, I know the absolute crazy pressures everyone's under at the moment. And we do need to find solutions, because there's nothing else magically happening to make things different in terms of the patient demand and the complexity of patients and the problems we're having with hospital appointments and delays. So I really feel like this is a great solution that I kind of want more GPs to find out about and get on board with.
Yeah, that would be amazing. We definitely need more people to create high quality evidence based health information, and as an authority as well, from a position of authority as a GP, you are best placed to share your knowledge in a patient friendly way, because you know the kind of information that your patients are looking for, and by creating that information you are filling that gap for not just one patient but every patient in future that asks that question, and you've got an answer there ready for them, and then you can review that information and say, here's the most updated video that I've created, where you can find that information. And then also, you don't have to create a video on absolutely everything. If you develop a team of GPs, for example, who create information, then you can share that workload and you can refer to each other's videos. So it's really nice to see the potential for community sharing with that information, and that's such an excellent use of health information. And then thank you for everything that you're creating, because it's clearly having a fantastic impact. So, as you know, at the Patient Information Forum, our mission is to help people like you to provide accessible health information for patients at the pub and the public, which you are doing. So, last year, I created a set of standards for health information called the Individual PIF TICK, and you took part in the pilot for that to try and be one of the first to earn a trusted information creator logo that you can put on your content to show that your content has been reviewed, your content process has been reviewed, and it meets these high standards. So I wanted to take a moment to say thank you for taking part. Your feedback has helped shape the Individual PIF TICK for future health information creators, which I hope will be more of your fellow GPs. And so the next question is, when it comes to how you create your health information, how did the Individual PIF TICK assessment help you with your creation process? And what were the key learning points that you took away from the assessment?
I thought it was going to be really easy, because I have always been so careful that every video I put out, every piece of information I give is based on guidance and is up to date, and I use references. And so I thought this will be simple because I'm already doing all the right things. But actually, it was a really robust process that was useful, because I hadn't kind of formalized my own process, because it's just me and my husband, and although I have colleagues who kind of maybe have watch over the videos before I release them, there wasn't a formalized process in place, and I hadn't ever thought or written down, what is my creative process, what is my production process. And there was some certain things like I hadn't particularly thought of, which is like having checked the review dates of the references. So I was always checking that it was, for example, if I found something that was an NHS, not NHS .co.uk, but if it was an NHS, like a hospital that had a patient information leaflet, I was doing that. But actually, was I checking that that was in date and reviewed? Well, probably not. So that kind of just made me just tighten up all those processes. And but it did make me proud as well that I felt like I was doing so much of it, but in terms of just formalizing it and thinking about every year, let me have a think back and see, has anything changed? Do I need to change anything? So it was more work than I anticipated, but it was useful. And to reflect back on it, I'm really glad I did it. And also for me, I think because I think there is some reticence from clinicians to send out a YouTube link to some person they don't know who I am. So I think for me, hopefully, having this accreditation will give people the confidence that they know that they're sharing robust information that is up to date, and they can be rest assured they're sharing good information with their own patients.
Thank you. Thank you so much for sharing how you create high quality evidence-based information. And on that note, I have something for you. So let me just share my screen so you can see it. So this, hopefully you can see, is your certificate.
Hooray!
So you have officially passed, and from the 1st of February, you will be able to put this image, which is the Trusted Information Creator logo, which is the PIF tick, and it says that this is to certify that Dr. Sophie GP has met the requirements of the PIF tick quality mark for health content creation. And this is valid for 1 year, and you renew it every year. And it's been signed off by our quality mark manager, Dan Wills. So well done. I'll be sending this to you officially on 1st of February when you can start putting the logo on your content as a trusted information creator, as one of the first.
Possibly the first. I'd like
Possibly first. I'll see your submission date.
I'm really proud. I'm really proud to have that, and I think PIF TICK is brilliant. And probably not enough people know about it, so it's great to be able to share that as well, and help people understand why it's so important when we're sharing health information to have this PIF TICK.
Yeah, perfect. Thank you so much. So I hope that you are really proud of yourself, and yes, you definitely earned it, and we look forward to the health information that you're going to create in future to support patients and the public with their health, and also your fellow GPs and other healthcare professionals as well. And not just people in the north of England, all over the world, like you said, people from all over the world. So having the maximum reach possible. And you'll also be listed on our PIF TICK individual creator directory with links to your social media channels and website. And we update and send this list to GPs and healthcare professionals twice a year as a resource, so they know where to find trusted health information for their patients. So I know you were thinking that, it's difficult for GPs to actually know and direct people to trusted information. So now it's going to be super official. And thank you for your time today.
Oh, that's wonderful. Yeah, really nice to speak to you. Thank you for having me on.
Thank you so much. And so for the audience, if you are watching or listening to this, if you'd like to learn more about the individual PIF tick and how to earn your own trusted information creator certificate, then go to our website and I'll leave a link attached to this video or audio post. Thank you for watching. Bye.